When patients come into my office, they may have been familiar with a few different anti-obesity medications, especially our Ozempic Wegovy type medications, because there's been so much attention to them in the media. But most are quite surprised that there are a variety of options, and there are a variety of options that do a lot of different things. When I am doing an assessment of a new patient who's coming in and we're trying to figure out what is going to be the right next thing, we are looking at a variety of different issues. I'm looking at whether they are someone who experiences a lot of food chatter. Have they had disordered eating? Do they binge eat from time to time or have a lot of stress or emotional eating, right? That is one problem that we need to overcome in order to have successful weight loss. Another problem that people might experience is being hungry all the time. People who always feel hungry, even after they've eaten, they just never feel that sensation of full that tells them to stop, right? That is usually something that has just been learned over time. There are a few rare genetic disorders that can happen, and that usually happens in very young children. But most of the time, it's just a learned habit where people are very tuned out from hunger signals and they just may not be able to perceive them. Sometimes people come in and they tell me they're doing all the right things. They have, changed their diet, they are exercising, they've worked on stress and sleep, and no matter what they do, they just cannot lose any weight or they're continuing to gain weight. Those folks often have metabolic dysfunction when we go and look at their numbers. Now, as an obesity medicine specialist, I am doing a deeper dive into their metabolism than someone who is conventionally trained, in primary care. As a primary care physician, I, for many years, would see some patterns, but numbers were normal, and that's all that I sort of took away from. I said, well, yeah, you're gaining weight, but your numbers are normal. But now, as an obesity medicine specialist, I'm trained to look at the numbers differently. I'm trying to look upstream of diabetes and prediabetes. I'm trying to look at the lipid pathways in a different way in order to be able to find insulin resistance, which we can often see with a standard cholesterol panel and some glucose and some insulin monitoring. So looking at all of those things together, and do they have a combination of things going on? Because they may have some metabolic dysfunction, they may have some binge eating or some stress eating that we need to overcome. We're looking at what are the problems that are getting in their way, and then deciding together which medications are going to be the most effective to treat this. We also talk about, okay, what is the insurance coverage? If you don't have insurance coverage and we think that a GLP-1 medication is going to be the right choice, are you able and willing to pay for that? There's a variety of different choices available, and some of them are expensive and some of them are not expensive. But we try and put all those factors together because ultimately I want people to be successful, but I need to understand which problems are leading to their issue so that we can address the right problems and figure out how to get them the outcomes that they desire.